My name is Jeffrey Brown. I'm 61, and in June of 2017, I had total left hip replacement surgery with Dickson-Diveley. I had a chronic condition since I was 8 to 10 years old. I had Perthes disease, which is now known as the Bo-Jackson disease. I was in a brace, crutches when I was 8 to 10 for several years. So I developed arthritis, and I basically had a limp and a condition with that leg my whole life.
Jeffrey first came to me complaining of hip pain due to issues that he had that first started when he was a kid. He developed something called Perthes disease, which involves losing blood flow to the femoral head part of the hip joint. Because of that, that leads to deformity and changes of the shape of the femoral head. And because of that, down the road, he developed arthritis in the hip.
My first visit with Dr. Wingerter was, at first I realized, wow, he's young. I mean, I think he's like 38, 39, but he was very confident, very quick, very definitive, and I liked that. I mean, it was a no-brainer to him that he could make my hip, tons better.
For Jeffrey, the best option was hip replacement because he had tried everything else and really wasn't able to enjoy life like he had hoped that he would be able to. He may be considered young for hip replacement by many of our traditional standards, but this was severely interfering with his activities of daily living.
It was a good experience. I was like, wow, this is nothing. I mean, it blew my mind. It lasted 40 minutes. I mean, that's hip replacement surgery. So anyway, my whole family was like, wow. Other than the first day coming off anesthesia, it was a good experience. He did good.
After surgery, Jeffrey had high expectations for his recovery, and we were hopeful to get people back as quickly as we can. In his case, he had been working with physical therapy and was starting to work with that right away afterwards as well. His goals were to get back to a very active lifestyle, and because of this, it takes a little longer to get back to everything that he had hoped to do. In his case, he was able to get back in a 4 to 6 week period, but he was back to most of his daily activities even quicker than that.
I would absolutely recommend Dr. Wingerter to family and friends. In fact, I already have. I thought it was a great experience overall. Easy access, good relationship, he's accessible. I really appreciated what he did.